Hi, I'm Neil Sen-Gupta. I am an epileptologist by training, so I specialize in the treatment of patients with seizure disorders, and also have clinical neurophysiology training, so I do a lot of intraoperative monitoring as well. Grew up in the Silicon Valley in the Bay Area, and as a kid, I always had a strong interest in computers. And I ended up specializing in electrical engineering for my undergraduate and really enjoyed sort of working with computers. During that time, I also realized that I wanted to sort of apply this towards the treatment of people. And so I went into medical school after that. And through that, I ended up finding neurology, which seemed to have many principles in common with kind of how computers are diagnosed and troubleshot and that sort of thing. Being able to apply those to people and their treatment really was a good connection within the field of neurology. And within neurology itself, seizure disorders involve a lot of these principles of being able to localize, understand where seizures are coming from, how things are manifesting, and a lot of the initial interest that I had in sort of the technical aspect is really present in a lot of the diagnosis of epilepsy, like through EEG, and they're figuring out where seizures are coming from based off of other techniques. I ended up pursuing a fellowship training at UCLA for epilepsy and clinical neurophysiology. And then I was on staff at UC Irvine for multiple years before transitioning over to my current positions doing intraoperative monitoring and with Neura Health for epilepsy management. My interest is in patients who have ongoing seizures, what we call refractory seizures, where patients continue to have seizures despite trials of two seizure medications, whether together or in conjunction. And that's where we start thinking about other potential avenues beyond just medications, such as perhaps neurostimulation devices or evaluations to see if there's a particular area in the brain that could be localized to try to remove, for instance, or add a stimulator to see if the seizure control can improve. So my interest within epilepsy is in refractory seizures that stay kind of difficult to treat despite seizure medications alone. I think the first, especially for the field of epilepsy, is an understanding of why seizures are kind of happening and if there's a particular cause that we can find for these seizures. And more importantly, it's a rapid access to care. It's known that for epilepsy specifically, there's often a long delay between the onset of people having difficult to control seizures and then being routed to the right places to be able to get definitive management if they're not going to be controlled with medications alone. So being able to really understand and identify when someone is having sort of these refractory seizures that require higher expertise as far as a center that offers things like invasive monitoring or in-house monitoring for seizures to be able to understand where they're coming from and is there potentially a role for stimulation or surgery is really important. It's known there's a long delay usually for that happening, and our goal certainly is to make that process a lot faster. The other part, of course, is just for the majority of patients whose seizures are well controlled on seizure medications, just making sure that they, again, have an understanding of the fact of why they need to take seizure medications kind of regularly, how to avoid triggers that could precipitate their seizures, and also to make sure that they're not having side effects to their medications. A lot of times, I think patients end up kind of just tolerating side effects because they're just so used to being on a medicine for so long, they kind of accept it as normal. Fortunately, in the field of epilepsy in the last 10, 15 years, there's been so many new medications that have come out that it's certainly possible to try to find something that's more user-friendly. And every person is different as far as how they'll respond to different medications. Trying for the patients with seizures that are well controlled, making sure that they're also not having intolerable side effects and optimizing them from that standpoint as much as possible. For epilepsy in particular, a team-based approach is really what comes to mind in that regard. Not that the patient should be the passive recipient of care of, hey, take this medicine, and here, let's add that. And okay, you're having some seizures, no big deal. We'll add some more medications and that'll be it. Maybe you'll have a seizure every now and then. No, it's really about understanding that the goal is to get to full seizure control, and that if we're not kind of there, what else can we do to try to optimize? Certainly, there's some instances where we might not be able to achieve that, but to get as close as possible to that goal and make sure that we've exhausted all the appropriate avenues to get there is really important. The other part of that is the appropriate counseling. So again, part of a team with a health coach to see about how do we correctly take seizure medications? How can we schedule things to make sure that there aren't inadvertently missed dosages? What kind of triggers might there be that we can potentially avoid or minimize, like alcohol or sleep deprivation and that sort of thing? So really to have the counseling and the resources where patients have that sort of autonomy to realize that they're just not being told what to do and having to accept, but part of a team, a support team that's there to be vested in their care and guide them through the process of epilepsy management. Certainly, there's organizations for epilepsy support, like Epilepsy Support Network, Epilepsy Alliance, that are available as resources. There's groups like the Epilepsy Foundation, which is kind of a nationwide group. And then within that, there's many more statewide and local affiliates for support. And then there's many grassroots organizations as well for epilepsy care, depending on where someone might live. And it's certainly helpful to get plugged into those resources and those networks. One key reason being that the realization is there that there's multiple patients who are kind of undergoing similar shared experiences with this. Epilepsy is one of these things where 1 in 100 people across the planet is dealing with epilepsy. And yet we don't hear about this anywhere to the extent as we do of other more rarer conditions that sort of get the media forefront. And for this reason, it's important to have access to these advocacy groups. Epilepsy Foundation is one that's sort of nationwide. And again, there's multiple other small organizations that might be more local that also exist. So getting those resources, depending on where someone lives, is often have events that occur sometimes monthly, every couple of months, where there can be a chance to talk to physicians who provide care for patients with epilepsy, to understand what the latest developments are, or to learn more about certain subtopics like epilepsy and sleep or epilepsy and mood, women's issues in epilepsy. These are all really helpful to be able to learn about, and also, more importantly, get to meet other patients and families who are also enduring similar kinds of experiences.